For OldFashionHealth.com, good health inside and out. Now I'm here in Sandy Springs at Atlanta Spine Doctors to interview chiropractor Rashad Sanford. How you doing?
Hey, how you doing?
Good to meet you, man. A little background: me and Rashad actually went to school together.
Right.
He graduated a couple years ahead of me, but just glad that we can connect here.
Absolutely.
Anyway, so Rashad, you're a chiropractor.
That's correct.
So what got you into that profession?
Well, to be honest, growing up, I had no idea what a chiropractor was. Didn't know
idea at all?
No idea.
Okay.
Just knew that I wanted to do something that was in the health field related to rehab injuries, and I was always big on taking care of people without drugs or surgery if we could get them and get their body functioning at a higher level. So when I was in undergrad, I was studying for my biology degree, and I turned around and I found out, well, I was running this health careers organization. We brought in a speaker from the chiropractic school. At this time, I'm doing research, I'm doing all these other things for different professions, and it turns out I found out about chiropractic. Now, I had a back injury from playing ball, and I had it for like 4 years, and it would actually cause me a lot of pain when I would play basketball, so I slowed down from working out and doing things. Go to the find out from the chiropractic representative about chiropractic, and I go to the summer program at Life University, my alma mater, and at that point I got my first chiropractic adjustment. So I get my first chiropractic adjustment, and I'm like, okay, I've been dealing with this back pain for like several years, and it's starting to go away.
So if you went all along, if you went to the chiropractor, you probably could have been ahead of the game.
I would have been ahead of the game, so far ahead of the game. Would have been playing. I'm not saying I'd have been playing with LeBron, but the funny thing was is not only did my back pain start to get better, but I started having more energy, and my immune system started feeling stronger, and all these different side effects, which were healthy, started coming about after I got the chiropractic adjustment. So at that point, I said, you know, this is something that I could see myself doing, and I found out about the different specialties aligned with chiropractic, that you can do more than just working with the spine, and I said, okay, yeah, this is where I want to go. So the big thing about chiropractic is a lot of people think it's just the back, but the reason that we work with the back is, in particular the spine, is because the nerves originate in the spine. And the nerves, there are 31 pair of nerves, and they travel all the way throughout the spine. They affect your heart, your lungs, your immune system, your liver, your kidneys. Anything that happens, it all starts with the nervous system. It's actually the first system that develops in the body, and then all of the organ systems take place after that.
So you're trying to put yourself at the top of the totem pole?
Yes, I'm going to say that the nervous system is the most important part of the body. You know, I work with other healthcare providers, but yes, without those nerves, nothing else is working. So most people think it's just what we call musculoskeletal issues, and just basically like the back pain and things of that nature. But there are other issues that can be people that have difficulty sleeping, bladder problems, digestive problems. So it works on all of those issues as well.
What are some misconceptions about being a chiropractor?
Okay, one of the big,
what's the biggest misconception?
Biggest misconception is that we're not doctors. That's the biggest.
So what do you say to those people who say that? Now, I'm telling you, I'm a believer, because I didn't have negative thoughts about chiropractors, but it's just not the back. It affects everything. But, so what do you say to those people?
Well, you know, a lot of the misconceptions are just due to a lack of knowledge, and the information hasn't been put out there, so people just go off of whatever thoughts they may have. In fact, chiropractors, I mean, went to school for 8 years, don't have a certificate. We actually take the same number of hours as medical doctors. We're also primary care physicians, where you can come off of the street and see us. You don't need a referral or anything like that. So the only difference between us and medical doctors is that a certain number of their hours are allotted to pharmacology and the study of drugs, whereas for us, it changes over to neuroanatomy, is more focused on the nervous system, and we also work on spinal manipulation. Other than that,
it's the same track. Other than that,
everyone else is doing the same thing. We do a residency for a couple of years while we were in school. We do all the same things. So there's no certificate at all. So we're trained primary care providers, and that's why I have an extensive network with everyone from your OBs to your surgeons to your dermatologists. We all work together. So that's one of the biggest misconceptions.
I'm glad you cleared that up. So what do people come in most of the time? What is their main issues?
Most common is back pain. That is number one. But then we also have people that have headaches, sinus and allergies. Some of the nerves that travel off the base of the neck travel and affect the sinuses. It can cause congestion. For people like me that have athletic specialties, I see knee problems, plantar fasciitis problems for runners.
Because you deal with a lot of athletes in Atlanta area.
A lot of athletes, So all levels, from high school to your college to your pros. And we work not only with the spine, because that is the foundation, but shoulders, knees, ankles, wrists. Any joint of the body. I mean, we want to make sure that it's at its optimal level, and that's what gives the athletes their edge.
So I get a sense it's a total body health here. Right?
Absolutely.
It's just not your back, it's everything.
Right.
What makes your practice different from the others in the Atlanta area? I'm talking about the Atlanta spine doctors.
Right. Atlanta spine doctors we pride ourselves, number one, which is most importantly, is taking care of the patient the way that we want our families taken care of. Okay. So we don't treat the patient as a number. You're not just in and out, don't have a conversation with the doctor or anything like that. But as far as the way we practice, we have the latest technology. So everything from not only just working with the spine, but we have digital motion technology that allows us to see the body in live motion, where we can see where normally people take x-rays and they just standing still, or MRI standing still, but we can see the neck move in live motion. So if you turn your neck and you have pain, we can see why and what's happening.
I think we're going to see that next.
We can see that. We do laser technology, cold laser. We have the strongest laser on the market here at the office. Wow. And that laser, it wakes up the cells. It's light therapy that speeds up the energy and healing process. So with normally the healing process was a certain number of time, but for us, we cut it down to 30 to 50% using this laser. So we do spinal decompression. We have a foot level body scan that maps the foot to allow us to see the topography, and if people have issues for runners or just general people that have balance issues. So we do a lot of different things. We pride ourselves on that technology.
That's awesome. Speaking of technology, let's get back here and see what you got.
Hey.
We're here at Atlanta Spine Doctors, again with chiropractor Rashad Sanford, and he is going to show me how this DMX works. Now, what does DMX stand for again?
Digital motion x-ray.
Gotcha. So this is part of technology that is not in the area a lot. This is one of the only spots in the area that you can get this, right?
Absolutely, yep. Right. Other than that.
So what exactly does this do?
All right, so this is a digital motion x-ray unit. It allows us to take x-rays as opposed to your traditional x-rays where you're just standing still and can't move.
Right.
This, we're able to see the body in live motion, real time, 30 x-rays per second.
Wow.
Yeah.
So some people may say, well, what about the radiation?
Radiation is minimal. It's normally, as you can see, we're not in a room that has lead walls or anything there. The radiation barely comes out to about right here. So it's the lowest dose of radiation.
So X-ray unit. Very safe stepping inside.
Absolutely.
Cool. So let's see how it works.
Alrighty. So you're going to just step right in here and just look straight ahead.
Okay.
Alrighty. Perfect. All right. We'll start with your neck. So I'm going to start seeing the picture. I'm going to move this up. I'm going to have you just open your mouth wide for me. Awesome. So we can see what's going on. And while your mouth is open, I want you to turn your head to the left and turn it to the right. Okay. Very good. And you can look straight ahead. All right. We're going to bring that down. So we're able to see the lobby. You see the spine, the windpipe. See that moving piece we look for right there? That would be your heartbeat. So that is very important. So I'm gonna have you step out for a moment. And all you're gonna do is step right in here, just like that.
Okay.
All right, that's perfect. Okay, I may ask you to take a baby step forwards or backwards. Okay, great. So we're here. Now we're going to look at the spine right here. I want you to tuck your chin to your chest as far as you can. Great. And I want you to tilt your head all the way back now like you're looking at the ceiling. Okay. Tuck your chin to your chest again. Okay. And tilt your head all the way back like you're looking at the ceiling. All right. Awesome. You can look straight ahead. All righty. Great. And you can step on out there.
Painless.
It's quick, easy. And that's the other thing. This unit is fast. So where you're normally changing out films and taking all this time, it's all computer based and it goes right there and
so
we're
I think
done.
Last time I was here, you can see that my hips, I think, were out of line, right?
Absolutely, yeah. We could see that. So we have everything in a whole database, cloud base.
I have my own folder. That's what you're trying to tell me.
You sure do. And as far as this, so we can look at a scan and we can see right in real time where this was your left hip and this was your right hip, and there was a shift where the left was higher than the right.
Yeah.
Yeah. So the hip issue, well, anytime any joint isn't in its proper alignment and the nerves are irritated, they're affected.
Right.
So the nerve can't send a proper signal to the body. It's kind of like stepping on a garden hose. the water isn't flowing as well. So you're functioning, you're living, you're doing everything, but you're not at your optimal level. So we can put your body through tests to stress certain areas that are in or out of alignment and find out how the muscles or signals are firing. And it's just one thing. As far as the leg and the hips and lower back, we normally I'll have you lay on your back, but I can test with your arm because I don't want you falling. So let's see. Well, let's start with this arm, right? So for example, and it's something, it's along the lines of what we call kinesiology. So I'm going to have you hold this arm up. Don't let me push down on it. You ready?
Yep.
All right, great. All right, so now I'm going to have you turn your head to the left as far as you can, and don't let me push down on it. You ready?
Yep.
All right. All right, well, let's try that again. And granted, folks, you can see my arm and you can see his. Don't let me push down on it. Okay, so try to turn your head to the right for me. Don't let me push down. All right, well, you're really trying. So that's one thing, and you can relax there. And that's because of the misalignments that we see here in your neck area. Now your pelvis, we also said was tilted, so we can test that out by stressing where one side is higher or lower. So we're just going to press a few areas. So once again, hold that arm up. Great. Can't push it down. Okay, so try right here. Don't let me push down. And because I'm stressing an area of his spine that is out of alignment, what happens is that his brain can't send the signals to his muscles to allow them to fire properly. This is how athletes get the extra edge when they're doing their runs or playing certain sports. And then for us in general, just our everyday activities so that our bodies function at a better level.
So what you're saying is I have to make an appointment with you?
Yes.
So what are your hours? How can somebody find out about you? What's your contact information?
Okay, so we're on the web at Atlanta Spine Doctors with the S at the end, .org. That's atlantaspinedoctors.org. Our phone number is 770-396-9100. And then we're also social media at Atlanta Spine Doctors. Facebook, Instagram, Twitter, all at Atlanta Spine Doctors. But yep, atlantaspinedoctors.org. That's how you can find us.
Thank you so much. I will be here next week.
My
Thank
pleasure,
you for taking the time out. I know busy, you got clients in and out.
No, I appreciate you guys.
Sign on the door for us. So again, this is Jazz for OldFashionHealth.com. Good health inside and out. Until next time, stay healthy.